Welcome to this video in which we are going to show you a case of the anterior segment. Here you can see that we have got lashes which are attached to the surface of the cornea. Probably that's most likely what you're seeing is cicatricial ectropion. And the important thing which you're seeing in this patient is this area of the cornea. This is an area which has been keratinized. You do not see that clear surface of the cornea. The epithelium of the cornea has changed into a stratified squamous epithelium, and these bands which you're seeing are actually symblephron formation which is going towards the lid. And this patient was a patient who had Steeman-Johnson syndrome, and over time this patient had developed this keratinization of this cornea. This type of problem is also seen in patients with ocular cicatricial pemphigoid. Here you can see the important part is if you look at this area, this shows that the cornea is deformed at this area and this eye looks slightly smaller in size. So this is looking like a more of a tricycle eye on this side compared to this other eye. The important thing for this patient is that he has very poor visual prognosis. As you can see, it is difficult, it's probably impossible to see from that area. The other thing which you like to see in this area is if you see this is the inferior fornix over here. If this is the lid over here, this inferior fornix is completely gone, or it is called obliteration of the fornix. Initially starts with shallowing of the fornix, in which you would see these bands which are formed due to symblephron formation. And so this is complete obliteration of the inferior fornix, and we come on to the other side. It's most important to look at the cornea again in this patient. Here you can see this is an area of the limbus where you normally would have the stem cell. Here the keratinization is less than the other side. Here you can see the most of the area which has been keratinized. There's a fold of symblephron going from this side to the other side. And the important thing is you do not see that glistening surface of the cornea. It's all dull, and the patient cannot see out from this cornea. And the procedure which is most recommended in these patients is an odontoid treatment is a keratoprosthesis, in which you would replace or put a keratoprosthesis in the cornea and then join the lid so that it can work in those patients. So this is a case which is very important to find out what the problems are, and it manifests manifold in producing keratinization of the cornea and obviously obliteration of the fornices. Thank you.